Okay, Crystal, when's your birthday?
September 21st.
Take your armband. I have some medication for you that's going to relieve your pain.
To administer intravenous or IV medication and fluid, reassure the child that it will be painless, assess her for allergies, and plan to observe the 6 rights of medication administration.
It might feel a little cold, but hopefully you'll feel better soon. Let's see. Does it hurt around here any? It looks good.
With the child positioned comfortably, check her IV site for signs of complications, such as redness and edema. Also assess the IV line's patency by checking the flow rate of the primary line, and ensure that the pump is working properly. Then vary your technique with the administration method. For IV push administration, clean the injection port that's closest to the child. If the medication is compatible with the running IV solution, connect the medication syringe to the injection port on the primary tubing and administer it at the prescribed rate. For greatest accuracy, use a watch to time the administration. For patient safety, monitor the child during administration.
Good.
When the push is done, remove the syringe and check the primary fluid in the infusion pump. If the medication and IV solution are incompatible, adjust the push procedure. Clamp the tubing above the injection port. Clean the injection port. Flush the tubing with 2 to 3 milliliters of normal saline solution. Administer the medication. Flush the tubing again with normal saline solution. Unclamp the tubing and restart the primary infusion. Note that some infusion pumps can be programmed so the primary infusion rate is resumed once the secondary infusion is completed. Therefore, it may not be necessary to unclamp the tubing as described above.
Okay, let me check your armband.
For IV piggyback administration, take a different approach. If needed, decrease the primary fluid infusion rate on the infusion pump. Then hang the piggyback medication bag, or volume control set with the medication, on the pole higher than the primary infusion solution, and set the proper rate on the infusion pump. The primary infusion solution must be kept lower than the secondary piggyback solution if infusing simultaneously. Using an antiseptic swab, clean the injection port on the primary IV line. Then connect the piggyback tubing to the primary line through the port. Set the infusion pump to the prescribed rate and set the pump alarm for the end of the infusion. When the infusion is completed, disconnect the piggyback tubing and set the pump to the correct infusion rate for the primary IV fluid. If the medication and IV solution are incompatible, adjust the piggyback procedure. Clamp the tubing above the injection port. Clean the injection port. Flush the tubing with 2 to 3 milliliters of normal saline solution. Connect the piggyback infusion to the injection port. Administer the medication. Disconnect the piggyback infusion. Flush the tubing again with normal saline solution. Unclamp the tubing and restart the primary infusion. For IV retrograde administration, follow these steps. Clamp the IV tubing below the injection port nearest to the child. Clean the port with an antiseptic swab. Then through the port, inject the medication so that it flows into the tubing above the injection port. Then unclamp the tubing and set the infusion pump to deliver the medication and enough IV fluid to flush the tubing. For medication administration with a mini infusion or syringe pump, begin by connecting a pre-filled syringe to the mini infusion tubing. Then gently press the syringe plunger to prime the tubing with medication. And place the medication syringe in the mini infusion pump. swab the injection port nearest the child with antiseptic. Then connect the mini infusion tubing to the IV-HL. Place the mini infusion pump on an IV pole or in a safe location near the child. Then program the pump to deliver the medication over the prescribed time. As part of your follow-up care, regularly monitor the child to assess the medication's effects, check her IV site to detect complications, and check the infusion rate and adjust it as needed.
How is your pain doing? On a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain you can imagine, what number do you think you're at right now?
I'd say a 2.
That's a real improvement. Good. How about that IV?
It's fine.
Do you have any pain here?
No.
Good. If you ever have any burning or pain at your IV site, please let me know.
Okay.
Looks like your infusion will be done soon. I'll be back in a little while to turn it off.
Okay.
Madeline, I have some eye drops for your eye infection, so I need you to lie down and look up and back.
To administer ophthalmic medication to a cooperative child, help her into a supine or seated position and ask her to tilt her head back and look up.
I'm going to hold your bottom lid down.
With the index finger or thumb of your non-dominant hand, gently pull down the child's lower eyelid. Rest your dominant hand on her forehead and hold the dropper or tube over the lower lid. As prescribed, apply the drops or ointment in the conjunctival sac. Don't apply the medication directly to the eyeball. Avoid touching the tip of the eyedropper or tube to the eyelid or conjunctiva. Then press one finger against the lacrimal punctum at the inner aspect of the lid for 1 minute. If needed, repeat this procedure on the other eye. Then have the child gently close her eyes. If you administered ointment, ask her to move her eyes in all directions to distribute it evenly.
I'll wipe off any extra drops for you. Ruth, I hear you get a little wiggly when it's time for your...
If the child can't cooperate with ophthalmic medication administration, adjust your technique as needed. For example, tilt the child's head back slightly or place a small child supine, and obtain assistance in restraining her arms and head.
I want you to look at the pictures on the ceiling and tell me all of the animals that you see in it. What do you see up there?
Which one do you see?
After positioning your hands, administer the drops or ointment, making a game of it. Alternatively, place the drops in the nasal corner where the lids meet. From there, the drops can flow into the conjunctiva when the child opens her eyes.
Okay, Kevin, tilt your head back like that. Good. Are you going to be okay like that for a few minutes?
Yeah.
Good. Kevin, if we're going to get this dirt out of your eyes, I'm going to need your help.
Okay, what should I do?
For eye irrigation, restrain the child's arms and head if needed. Fold a towel and have the child or parent hold it on his cheeks, just below his eyes.
Now, Kevin, look up over your head for me.
Direct a steady, gentle stream of fluid to the lower conjunctiva.
Hold your eyes open.
Carefully move the lower lid from side to side to flush the entire area.
Very well.
Next,
Now.
direct the stream to the upper conjunctiva, moving the upper lid from side to side and up and down. Repeat your irrigation of the lower and upper conjunctiva 5 times, or for at least 5 seconds as
And
needed.
A few more times.
When the irrigation is completed, dry the child's eyes and face.
And Ruth is going to be going home on eye drops. We just want to talk a little bit about how to do those properly. She's going to be getting 1 drop in each eye 4 times a day. So with meals and at bedtime would be a good time to figure those out.
As part of follow-up care, teach the parents and child how to administer the ophthalmic medication at home if prescribed.
Drop in her tightly closed eye, or you can pull down on the lid and make sure it goes into the corner. If you want, you can give her a break between each eye. Do one and then wait for about a minute and then do the other eye. You'll want to have a tissue in your hand when you do that, and let her lie flat there for at least a minute or 2 after the drops are in.
Okay.
Yeah. Okay, did you have any questions?
No, I think that covers it.
All right, and of course for the 7 days that they had given you instructions, that's how long she'll be on them. Her eyes will look and feel better, but you want to make sure that you continue to give the drops for the full length of time that they're ordered.
Alrighty.
Okay.